Good afternoon, and thanks for joining us for today's Healthline. I'm Shannon Bernius, where we like to focus on ways to live a healthier, happier, and pain-free life. We're going to be taking your calls in just a moment, answering your questions live in studio today, and we'll be opening up the phone lines. And as a reminder, please make sure you're in a quiet room when you make those calls to us with the TV turned all the way down. That helps the audio come into us just clear and nice. Our number is 318-219-4569, and today's topic is heart failure. So today we're here with Dr. John Winterton of Willis-Knighton Piermont Cardiology, and thank you so much for joining us.
That's right. Thank you very much.
Well, let's talk about heart failure. What is heart failure?
That's an interesting question because most people conceive heart failure as relating to the heart not pumping well, as in not able to squeeze and get blood to the rest of the body, the vital organs, etc. It also is related to a condition by which the heart does not relax appropriately. And both cause significant symptoms. Both are associated with poor outcomes if not treated properly. And interestingly are about 50% each representing the totality of heart failure. It's about 35 million people in the United States. About 18 million with poor heart function, and about 18 million or so with heart failure based on the heart not performing its relaxation properties as it should.
Can this condition be reversed ever?
A lot of it can be reversed from the standpoint of heart failure caused by poor heart function, poor ability to squeeze and push blood out. Many times that can be reversed because the cause predominantly is heart artery disease. And certainly we have the ability to improve the blood flow to the heart. We've gotten to be pretty good plumbers over the last 50 years or so. And by improving the blood flow to the heart function can improve. The other group of folks who do not have heart artery disease can be also treated with what we consider guideline-directed medical therapy, which is comprised of 4 or 5 classes of medicines, which are all associated with improving survival and improving outcomes, keeping people out of the hospital and feeling like they'd like to feel.
We all know that your weight can play a part in it. Should I be weighing myself daily, or should we be weighing ourselves daily? And at what point do we make an appointment with the cardiologist?
Well, there are a whole host of things that people should be paying attention to relative to their health and heart health specifically, but they center around the major risk factors for heart disease. They are similar throughout the spectrum of heart disease, inclusive of heart artery disease and heart failure. But we look for patients, or are paying great attention to patients who have diabetes, and therefore paying attention to diet, paying attention to your blood sugar, and so forth is important. Paying attention to blood pressure, and blood pressure management is critical. Maintaining an active lifestyle, so weighing yourself, knowing what you're doing, and having a purpose, a guided purpose for activity is very important. Genetics play a role in this. You can't obviously undo genetics. And then lastly, not doing things that are harmful. So smoking being at the top of that list. We like to say that if there were 10 risk factors for heart disease, there are only 6, but if there were 10, the first 5 would be smoking. And so avoiding things that are harmful. So smoking, excess alcohol consumption, excess sodium consumption, and therefore generally paying attention to and being intentional about what you do and consume make a big difference.
Speaking of diet, are there specific diets that really perform better for people when they're dealing with this?
There are obviously a large host of diets out there. The essence of them all is focused on low cholesterol and low sodium. And you can use basic cardiac diets as described by the American Heart Association, the American Diabetes Association. Both have really well thought out programs. There are other diets that people can use that are very useful. The Mediterranean diet probably being at the top of that list. And it takes a nice makes a nice combination of things that are palatable and enjoyable with avoidance of unsaturated fats and or polyunsaturated fats and excess sodium and so forth.
And excess sugar, of course, too.
Right.
And so if I were to be diagnosed, how often should then I be going back and seeing my cardiologist?
Well, patients who have heart artery disease or have heart failure need to be seen often, particularly patients with heart failure, because early recognition of deterioration is important and useful in terms of keeping people out of the hospital. Some cardiologists vary in terms of the frequency with which they want to see patients, but certainly every 3 to 6 months. We have some new tools that are available to us to be able to monitor heart rate and blood pressure and weight. Weight is an important feature in maintaining patients who have heart failure. Weight is an interesting issue. It represents both lean body mass and water mass. And water is the enemy as far as heart failure is concerned. Too much water means too much work for the heart to contend with. It backs up into the lungs and everywhere else and causes the symptoms of shortness of breath and swelling, et cetera, that people so often associate with heart failure.
Interesting.
So weight is an important feature to that. If you're careful about watching your weight, then you can detect even small increases in excess fluid volume.
Okay.
So a nice tool, but it requires constant and frequent monitoring.
Okay, so those constant visits. We are going to be continuing with our questions with Dr. Winterton, but I do want to make sure that everyone watching this, and we know that heart disease, heart failure does affect a lot of people out there. In fact, I did a report earlier this week where it unfortunately kills more people than all types of cancer combined. So this is something we all should be concerned about, if not for ourselves, then for a loved one. So if you have questions, the number to call here is 219-4569. Pick up the phone, ask your question. No question is too light or too circumspect. We can get the doctor to answer. And also, if you have questions that you want to maybe talk to his office about, their number is 318-212-3858. And the office at Piermont Cardiology is East Burke Coons Industrial Loop. The exact address is 1811 East Burke Coons. And you can also go to them online at WKHS.com. So bring those calls on. Now let's get to this next question. How is this going to affect my daily life? I mean, will I be able to work? Will I be able to go on trips?
In the past, if you go back 30, 40 years ago, heart failure was crippling. People couldn't function, they couldn't perform their daily activities, they might not be able to work. If they'd been sick, they spent protracted periods of time in the hospital. It was very common to be in the hospital for weeks with this kind of an illness. Whereas today we try desperately to keep people out of the hospital, and we want folks to be physically active and engaged in normal day-to-day activities. And
Exercise
yes, that's
too?
achievable. Yes,
Exercise
absolutely.
too? Okay.
Heart is a muscle, and therefore is conditionable just like the muscles in your arms and legs. And so exercise is a key part of this. Now, obviously, exercise limitation is also an issue for patients who have heart function that is not normal. So there can be limited, but yes, absolutely, exercise is a very important piece of the puzzle. We use, in a controlled fashion, we use cardiac rehab. That's a well-known entity, and Willis-Knighton offers that as a source of therapy. And but these are things that are also usable at home and easily attainable in terms of resources to know what to do and how to gauge your activity and diet and such.
Now, I think I know the answer to this question is because I had a family member who had chronic heart disease, and so they had their own blood pressure monitor cuff at home. So I'm guessing the answer to this question I know, but how often or should we be monitoring our blood pressure at home?
For patients that have high blood pressure, which is a very important causative agent for heart failure, checking your blood pressure at home often is a really good idea. Now, you can overdo that, and becoming obsessive about it is not helpful. It can actually make you more worried and create problems that are not would not otherwise be an issue. But checking your blood pressure at least 3 or 4 times a week is very good, particularly for patients who have high blood pressure. For patients with heart failure, it's probably a good idea to check blood pressure daily. There have been, as I mentioned, some significant advances in our ability to convey that information to the doctor's office by way of remote patient monitoring. And so patients can have certainly their own blood pressure cuff and keep record of it and bring it to their doctor's office. And I absolutely encourage folks, if you're going to check your blood pressure and keep that information, to bring it to the doctor's office so that there's a frame of reference to work from to help improve quality of life. But we also have the ability to provide blood pressure monitoring, blood pressure cuff at home. It has connection through the cell phone service so that the information is immediately downloaded onto the medical record and then monitored. Nice. And we can do that with blood pressure and heart rate and weights, which is very valuable for patients with heart failure.
Is it through an app? Is that how they do it? Essentially,
yes. Yeah. It's through the cell phone. It has the equipment itself has a cell phone device that transmits the information to the electronic medical record, and then triggers a response from the physician's office that's monitoring it. And that can be done through most physicians' offices. Certainly within the heart failure program.
And that's wonderful for people who may not be the best at maybe writing down things, keeping that accurate record, doing it daily, all those things.
Absolutely.
Like myself.
Even more important for folks that don't live immediately available to their doctor's office or the hospital. People living remotely, and we have a large extended community in Shreveport, to include the several parishes, and so it avails a little closer level and higher level of care to those folks.
Indeed.
And outcomes are directly associated with improved outcomes are directly associated with that monitoring.
Okay, again, you can find out more by calling your office or going to the website, WKHS, I assume. I do want to ask this, does heart failure or heart disease, does it lead to other issues with our health?
Well, heart failure implies that the heart, again, is not performing at its best. And the heart's function principally is to push oxygenated blood to all the organs, the muscles, your arms and legs, your brain, particularly important, your kidneys. And so the poor heart function and therefore heart failure can negatively affect function of those vital organs. It's particularly noticeable in lung function and in kidney function. And so there's a lot of overlap between that group of patients who have kidney disease, lung disease, and heart disease.
It sounds like we have a caller on the line. I do want to get to her question. Gloria is on the line. Gloria, you're on with Dr. John Winterton.
Yes, ma'am. I was going to ask the doctor if he would tell me my heart rate keep going up. And I was wondering what some of the things that cause it to go up. Because I think I talked to someone once about it, but it'll just go up.
Well, increased heart rate is an observation that is common, and increased heart rate can be caused by lots of different things. Increasing your activity
I'm sorry.
Go ahead. It's okay.
Heart condition.
It doesn't necessarily mean that you have a heart condition. It would mean that you need to see someone and have that evaluated so that you know what the cause is.
But I was going to ask you too one more question. I'm not going to hold you because I know your time is valuable. But do cholesterol have anything to do with your heart rate going up and down, or dehydrated?
Cholesterol medicine would not directly affect your heart rate, no. Patients who have high cholesterol are part of the group of people who have heart disease, and so sort of in an indirect fashion, I suppose there's an association, but the medicine itself would not cause increased heart rate. That sounds like something that needs to be evaluated.
What about dehydration? I think she asked about dehydration.
Yeah, dehydration can cause your heart rate to be elevated. It would.
Again.
Okay, well, thank you, doctor. Right. And
Yeah.
I don't want to take up no more of your time because I know your time is valuable. And thank you very much.
You're
You
very
have a
welcome.
blessed day.
Gloria, getting to see your doctor, it sounds like. Thank you so much for calling in. We appreciate it. And anyone else out there who wants to give us a call and wants to ask questions of Dr. Winterton, I just want to mention that in the number again, 219-4569. See, it helps to get some answers to questions. It may maybe propel you to going to see the doctor. Hopefully it did in Gloria's case. How fast, if you are diagnosed with heart failure, how fast does it progress?
That's very variable depending upon what the cause is, and it also has a lot to do with the point at which it's discovered. Some people manage to allow their overall lifestyle to be modified, and therefore sort of neglect the fact that something's not right. In other words, not tolerating activities. Well, I'm getting too old. Well, I often tell people we're not going to let your age be an excuse. You should be able to do the things that you want to do, and if you start to notice a decline in activity tolerance, certainly if you notice that you're short of breath or having chest discomfort, those are all things that need to be brought to the attention of your physician, because those are signs that the heart function's not what it should be potentially. Once the heart failure is recognized, if reversible causes are identified and treated, sometimes that resolves the problem. In folks who have permanent damage to their heart muscle or permanent heart muscle dysfunction, getting on the proper medications can directly influence it. And so the answer to that question is somewhat nebulous, because we have the ability to influence and help people live longer today with those therapies. In folks who have severe heart failure, people who are spending most of their time in the hospital or hospital-like circumstances, the outcomes are not as good, and so we talk about 50% 2-year survival in folks who are having serious limitation of their ability or inability to function at all. So it ranges from what we consider class 2 heart failure, which is somebody who just has to slow down just a little bit, to class 4, patients who can't get out of the bed. And obviously within that range are different prognosis associated outcomes.
And one thing to point out is that heart transplants are a very difficult procedure, very life-threatening procedure to get done. So it's not like you can sit there and say, oh, well, if I go down this path and don't take care of my heart, I can always get a heart transplant. It's not like that.
Roughly 3,000 heart transplants per year in this country, and that number has not changed in 40 years.
Wow.
So it's a very small number. Yes, there are some wonderful mechanical support devices that are out there, and a lot of growth in that arena, including heart transplantation, that's centered around making organs more available. But early recognition and treatment can keep you out of that ballpark.
We have Randall on the line. Randall, you're on the line with Dr. Winterton. What's your question?
I recently, about a year ago, had an open heart surgery, and they put them veins in my heart. I was told that them veins only last so long, and they die out, and when they die out, you die with them. Is that true, or is there a limit on how many years them things are supposed to stay in before they die out?
No, I don't think. I think that's a common misunderstanding.
He said drains, right? Drains?
Veins.
Excuse me,
Yeah.
veins.
So veins are, coronary bypass surgery is a procedure designed so that we identify blockages in the small arteries that run on the surface of the heart, supplying the heart with blood flow. Yeah, and you had that done, and so what they do is take a vein from the legs, tie it into the aorta, and then tie it in past the blockage in the arteries in the heart to literally bypass a blockage. Well, the average point in time where people begin to see trouble again after their bypass surgery is somewhere around 10 to 12 years. That does not mean that at 10 to 12 years things are going to go poorly. As a matter of fact, with roughly 30 years of experience, I can tell you that I have many patients that have had bypass surgeries that are doing well 30 plus years since their original surgery.
So it's the average. It may
That's
go
right.
on much longer.
I would not even think about that as an issue. The thing to focus on is how do you keep the problem from getting worse, which is to control those things that are controllable. Specifically, if you have diabetes, treat the diabetes. If you have high blood pressure, aggressively treat high blood pressure. Aggressively treat cholesterol, and stay away from those things that are damaging to the heart, which are things like cigarettes and alcohol. And if you do those things, with today's medications, we have the ability to dramatically improve outcomes. And the bypass surgery becomes then just part of the treatment. But I would not put a date or even worry about a date that my bypasses were going to go poorly or no longer function. Rather focus on trying to make them work for many, many years.
Do your part, exactly. Well, we passed the halfway point, so I do want to remind people, if you'd like to call in, like Randall, like Lori, get your questions answered. Dr. Winterton is here, the number you see right there on your screen. I don't know if Randall's still online. Is he still on the phone?
Yeah, I'm still on. My brother, my oldest brother.
Did we answer your
Yes,
question?
I'm here. Well, I was trying to find out if you put once they put them veins in you in the bypass, how long do they last?
Many years, many patients as long as 20, 30 years or more.
Well, that's what I was wondering, because my oldest brother, he had it done years ago. That was before they had a lot of new tech, and he lived about 10, 11 years. And they told him that once they die, he dies, because I'm 80 years old, so, I had it, but I'm doing good. I don't smoke, I don't drink. And
Good for you.
I don't have cholesterol problem.
Well, if you do the things that are recommended with your blood pressure and cholesterol, and you stay away from smoking and alcohol, you can expect good things. On average, if you live to be 80, you can roughly expect to live at least 10 more years.
We'd love to see it. All right, Randall, thank you. Thank you for calling in. Well, and I wanted to ask you, doctor, is there a test that people can take? Is it out there where you can be tested strictly for heart failure, or are you being tested for your symptoms from heart failure?
Symptoms themselves are the early recognition point, and I like to try to emphasize that the thing that classically people associate with heart failure is shortness of breath and swelling in their legs, and those are simple and easy recognizable symptoms. The problem is that they're most often preceded by simple things like decreased activity tolerance. And often we excuse that to, it's holiday time, I've been eating too much, or I've been inside, I haven't been outside conditioning myself. If you notice decrease in activity tolerance, or that things are just not right, that's the point where you need attention, not to wait till your legs are swollen or you're really short of breath. That's where things have already gotten down the road. So early recognition is key.
All right, we have Tara on the line. Tara, what's your question for the doctor?
Hi, my husband is almost 85. He's got AFib, and he had a mitral valve replacement. My question is, how bad is red meat for him, because he exists on it?
Well, that gets to the whole notion of cholesterol management. So diet directly affects cholesterol. There's some misunderstandings about that, because each individual has genetically programmed systems, enzyme systems that are designed to metabolize fats. And if you're in the group of people who inappropriately metabolize fats, then their diet plays a bigger role. So we want people to be very cautious about their diet in that set of circumstances. The bad cholesterol, the LDL cholesterol, which is a component of the total cholesterol, the bad cholesterol needs to be kept within guideline ranges. And for somebody such as your husband who has heart disease, that number is very, very low. In patients who have had heart artery disease or bypass surgery, stents, heart attacks, that group of people, the LDL cholesterol needs to be kept below 50, which is nearly impossible without medication, even in people who didn't have otherwise high cholesterol. Diet plays a big role, and red meat full of saturated fat is not a wonderful thing to make the principal portion of your diet. In general, 8 ounces of red meat a week is sufficient for your body's needs for iron and that portion of the protein allocation you get from red meat. To consume substantial quantities of red meat when you have heart disease is not ideal.
So basically find a way to fix up chicken or fish so that it tastes just as tasty as the red meat, yeah?
You are correct. Thank you so much.
All right, we appreciate your question, Tara. So Tara, Randall, and Gloria have called in. I think we're getting close to the end. If anyone else wants to call in, now's the time. It's apparently, I'm told that it's cutoff time for the question. So we do have a few more questions that we would like to ask the doctor. I'm wearing red right now because it is Wear Red for Heart Health Awareness Month here nationwide. Do you find more people, because of the big awareness campaigns that are going on here at our station and other places throughout the U.S., do you find that people start to maybe perk up and say, I need to pay more attention to these symptoms or to my heart health this month?
We do see that as Heart Month, and particularly Women's Heart Month, which is coincidental with Heart Month, brings up people's level of awareness and at least the thought that maybe I need to pay a little more attention. Ideally, though, it's a continuum. So this would be the trigger to think about it during the month of February, and there are lots of available screenings out there. Willis-Knighton is offering a special for cardiac calcium score, which is a nice screening tool for heart artery disease during the month of February. So it's a trigger, but recognition of heart disease is a continual thing, and it's critically important if you're to avoid heart failure, which is obviously the end of of the process, what we prefer not to have to contend with. You have to pay attention to that on a daily basis. And that's diet, exercise, control things that are controllable, diabetes, high blood pressure, high cholesterol, and avoidance of those things that are catastrophic, which are smoking anything.
That goes for vapes too.
Vapes are potentially worse, based on the data over the last 5 to 10 years, than even cigarettes. Consumption of or smoking marijuana has drawn a lot of attention, and there is the potential that is equally negative in terms of the progression of heart disease. So you have to pay very careful attention to what you're in contact with. And excess alcohol consumption is the same thing. All of these are not to be taken lightly.
So as we've been talking about, you need to take care of your heart. It is a muscle. You need to be protective of this muscle that does so much work through our bodies. And really, obviously, if you're talking about the number of transplants taking place over the last 40 years remaining virtually unchanged, that is not a go-to option. You need to take care of your heart and get yourself in the best health you can. If you'd like to find out more about those heart scans, the cardiac calcium scans that the doctor was talking about, you can go to the Willis-Knighton website, WKHS.com. Also, if you'd like to visit the doctor at his office or set up an appointment, they're located at 1811 Burt Coons Industrial Loop, and their phone number is 318-212-3858. This has been a Healthline 3 report, and we thank you for watching. I'm Shannon Brinias alongside Dr. John Winterton. We really appreciate you watching. We appreciate the questions, and we hope you tune in to the next Healthline 3 report.